The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your health care needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me. I listen to what they're saying. I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call today and schedule an appointment. If you wait, it may be too late. To my military family, I got your six. To my Masonic brothers, the light is bright. Today's show, I brought Glenn Greeley of Revital Wave.
Thank you for having me, Dr. Tommy.
Yeah, so we want to go over a couple things because you're going to be adding new services to your current service menu.
Yes, we are.
We're here to make a difference in the community, have fun, and make patients feel good about themselves.
That's what it's all about.
All right, so let's go over some of the services. First, where are you located?
So we're at 1757 Veterans Highway in Islandia.
Islandia. I was always confused because I always thought like the airport and just slightly north of the airport was Islandia, but it's really further north than that.
Yeah, you know what it's like? It's weird because we have like Ronkonkoma, Bohemia, Islandia, Hauppauge, like all right in the same area. You know,
yeah,
you could be on one side of the street and be in one town, the other side of the street you're in another. So.
Exactly. All right. So, what services? What type of practice do you have there?
So,
business, I should say.
What we call Revital Wave, we call it a health and wellness center for men and women. So we deal with sexual function for men and women, ED, and postmenopausal issues for women, and we also do red light therapy, sports recovery, pain management. You know, when people get to our age, we start things kind of slow down for us. Things stop working, but we want to keep going, and that's what Revital Wave is all about: keeping that vitality in your life, managing pain and inflammation. And now I'm really excited about the new thing that we're doing.
Yes,
weight loss.
Weight loss. That's so important. I had a program a couple of months ago. We were talking about defining obesity. I'll go through that right now so people have an idea. So we have what's called ideal body weight, and that's based on your height and your frame size. And then if you're 10% above ideal body weight, only 10% you're overweight. If you're 20% over ideal body weight, you are now obese. Right. If you're 100% over ideal body weight, that's called morbid obese. So it's very significant in our population because it's related to so many medical conditions that are preventable because it's based on your body habits.
Yes.
Your weight. Just to name a few, you're talking hypertension, with diabetes, diabetic neuropathy, back pain, knee pain, hip pain, all sorts of musculoskeletal conditions that are associated with your weight.
Yeah, absolutely. And, the main reason that we want to go down this road and get and add this to the practice is because a lot of our patients come in. A man comes in, he's got ED. Mm-hmm. So obviously he's coming to Revital Wave because he's heard about our acoustic shockwave therapy, our Aspen laser treatments, and he says, I really want to fix this. And we discover that he's got diabetes. Right. Or maybe he's a little bit overweight. And these are things contributing to it. So rather than just take somebody's money and do this treatment and not have it successful, we want to treat everything. So when we notice someone's a little bit overweight, we tell them, look, we have to address this issue too at the same time. And it's amazing when you see someone start to transform. So that's why we're making this an integral part of the practice. So we have a registered dietitian, mm-hmm. and someone who, like you said, is morbidly obese. They need to see the dietitian first. They need to get on. They really need to get their diet on point. And then once they lose a little bit of weight, then we can start some of the other therapies and get them where they need to be 100%. Not just one aspect of their life, but everything. When you lose weight, you look good, you feel good. When you get your sexual functions taken care of and you're back to feeling vital again, it just changes your whole world.
It does. You have a better outlook. It's a holistic approach.
Yeah.
It's not just take this pill.
Right.
No, it's a behavioral modification. You have to look at everything, a holistic approach. Mm-hmm. The same thing when you're treating a patient, it's a holistic approach. It's not going to be just take this pill. You have to look at them, see where their mindset is, and then you have to make the necessary adjustments based on them. It's not cookie cutter because, we're all the same, but we're not.
Exactly. Yeah. Everyone has different needs.
Exactly. And based on behavior, it might not be because your input versus output, the reason why you're overweight is because you're eating too much and then you're not exercising enough. Yeah, that may be, but then it might be due to a metabolic condition. And if you're not addressing the metabolic condition, you're not going to lose the weight.
Exactly. And that's why it's so important. You and I speak about this all the time, and it's important for the listeners to know this. You do need to have an MD. You need to see a doctor. Like when patients come to see you, you're not just looking at one thing. You're looking at everything.
Right.
You're looking at underlying causes, and it's very important. And it's not just a disclaimer. You see these fad diets, these things on TV, and it always says, there's always a little disclaimer at the bottom. Make sure you're MD supervised and may or may not work. Results not typical. Basically, what they're saying is their product is really nothing without the doctor.
Right. Well, they have the disclaimers because illegal actions, and if you don't get the success, they say, you fall into that percentage and it just doesn't work. The key here is to raise that percentage, and you're having a holistic approach. Again, the mind, body, soul, mind, body, spirit. You need to educate them, and then you guide them, and you have different disciplines looking at a different approach, and you come together and you make the best decision. I know as we are both business owners, the last thing we want to do is sell an individual on something and make a promise. And then, because like in medicine, there's no guarantees and warranties. And that's what and there's no such thing as a cure. A lot of people, they want a cure. No, cure means it will never, ever come back. And that's not the case in medicine. We have only treatments. But the last thing we want to do is offer a treatment, and then it fail, and that's because you didn't do a thorough job, and because we're giving you a treatment that wasn't designed for them. It was really designed for something else because you're using more of a cookie cutter approach.
Right. Yeah, it's very important. And that's the one thing we always stress. Like when a patient comes in for the consultation, the men meet with me, the women, they're meeting with Fran. During the consultation, we always stress the fact that, this is a therapy. We're kind of like the gatekeeper. We're trying to prevent you from having to go surgery or an endless cycle of medication. So we get two types of patients. We get the people who looked at the surgeries and the medications and said, I don't want to do that. I need to do something better. And then we get those people who they've taken the medication. It didn't work. They had side effects, or they even had a surgery and it didn't work. And they recovered from the surgery. Now they're coming to see us to see if this will work. So it's always It's always a good way to, start that consultation by telling people, look, there is no guarantee 100%. Everyone is different. However, isn't it worth trying before you go have surgery, before you have the risks involved with the surgery or some of the medications, like, talking about ED specifically and women's sexual function. When they look at the surgeries and the laser treatments, a lot of times they're like, oh boy, this is a little scary. And I said, well, isn't it worth it to try a therapy, something that's more natural, something that's non-invasive, no medications, no injections, no surgery, be much better. And they like that.
Right. Well, that's why you need to sit down and have a thorough interview so you can make the best approach. All right, so we have less than 45 seconds left. If I need your services, how can I find out about your services?
Revitalwave.com. At revitalwave.com, you can get all the answers to the questions that you have. It's a lot of good information, and you can book your free consultation right there. Or call 631-597-0000.
That's right. Make that call today. If you need help, make the call today. All right, so let me help you lead a happier and healthier life. If you wait, it may be too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Yakbank Road, Suite 16, which is the garden level downstairs, East Patchogue, New York, or give me a call, 631-980-8200. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. Today I'm here with Glenn Greeley of Revital Wave. Glenn, welcome back to part 2 of the Dr. Tommy O Show.
Thank you for having me.
All right, so let's get into a virtual walkthrough. Now, I hear your commercials because you have your own radio show on 103.9, and you're here today. You've been on a couple times with me. So I am a listener, and I say, you know what? I believe I qualify for these treatments. So let's do a walkthrough.
Yeah, the toughest part is always that first phone call or that first booking the appointment. That's why we make it easy. You go to revitalwave.com. You can book your consultation. There's a calendar right there. You can pick the day and time you want to come in. And obviously, men, you would end up with me. I'd be the male consultant. If ladies, if you're going to book your consultation would be with Fran. Both of us are very knowledgeable. We're all both certified in GainsWave and FemiWave and all the modalities that we use at Revital
Hold
Wave.
that thought right there, okay?
Yeah.
What do I always say every time when you're looking for someone, right? You're looking for a business. I always say certified.
Yes.
Certified. That's so important because they know they have the proper training. So you're certified through the company.
Absolutely. Everyone at Revital Wave holds certifications and everything. So we get trained by the doctors that actually invented this technology. So very proud of that. And yes, you should always look for that. So you making that call, and if you call the office, you're not going to get judged. No one's going to, this is not unique. There's hundreds of thousands of people with the same problem. We hear it all day, every day. So you have nothing to be ashamed about, nothing to worry about. It's no fault of your own. It's a legitimate medical condition. We get older and you want to take care of these things and keep yourself vital. So you make the call or you go online, you book your consultation. Now, when you come into the office, we always say that we provide first-class medical care in a spa-like setting. Mm-hmm. The one thing that gives a lot of people anxiety is they think, oh boy, it's hard enough for me to talk about this. Now I'm going to sit in a waiting room with 30 other people looking at me, and this place does men and women, so there's 20 women they're looking at. That doesn't happen at Revital Wave. Right. Our waiting room is very small and it's very private. So we did this on purpose. We don't book like a traditional medical office would, where there's 10 different physicians and people there for all kinds of things. We stagger our appointments out so that it's private, it's relaxing. So when you come in, you feel good. There's no news on the TV. It's just nice, relaxing scenery. We want you to feel at ease. So you come in, you get your consultation. Guys, if you're coming in, you're going to meet with me, and we're going to go over everything. We're going to go over your medical history, what things might be causing your ED or whatever issue you have. Maybe it's not. I do get a lot of guys who come in and they say, I don't really have ED, but I just want to perform a little better. I feel it's not like it used to be. So we treat everything. We can help everyone. So when you come in for that consultation, We go over everything. We lay out the plan that's right for you. I can even show you around the place. You've been there. You've seen our red light bed.
Yes,
it's very, very impressive.
The office is very clean, just like my office.
Yeah.
It's an extension of our personalities, and it reflects who we are.
Yes.
And then, the last thing you want to do is go into the office and the walls are dirty, holes in the wall.
Yep.
Then you just say, this guy doesn't care about the office. Is he going to care about me?
Exactly. No, that's why you and I work so well together, because we are on the same page with that. Your patient care, making the patients feel relaxed. I've been to your office is phenomenal, by the way. I love. I got to tell the listeners, if you've never seen Dr. Tommy O's office, you really need to go. You need to schedule an appointment with him, because it's very, very impressive. A lot of great artifacts, medical history. But it does. It shows people just how much you care about your craft, and how much you care about them in turn. But it is important. So when you come into Revital Wave, that's how we want you to feel. We want you to feel like you're in a nice, clean, tranquil environment. Mm-hmm. And everyone there, like I said, is certified. They're all very experienced. They can answer any question that you have. And we make you feel relaxed and comfortable. We'll show you the red light bed. We show you the acoustic shockwave therapy machine, so you know exactly. All right, this is what I'm going to be treated on. This is what's going to happen. This is how my treatments are going to go, and we lay out everything for you just to make you feel comfortable. And for men and women, that first treatment is always a tiny bit of anxiety. I don't know what to expect. Is this going to hurt? Is this going to be bad? It doesn't hurt. It's painless. It's non-invasive. There's no downtime.
Right. I
have a lot of guys who come in on their lunch hour, who say, hey, you know what? I got lunch from 11 to 12. Can I come in? Yeah, come in 11:15. You're out by 11:30. Right. It's that easy. Same thing with the women. You come in, you get your treatment done, and then you know what happens? After they finish their treatment cycle, they say, I don't want to stop coming. Mm-hmm. I had this great result. I'm feeling good. I look good. Everything is going well. I don't want to stop coming. Right. So we have the membership program, and people love that. They come in once or twice a month. Some people come in for the red light bed once a week. I have about 4 or 5 people that come in more than once a week, because they just love that red light bed. They feel so relaxed. They feel it relieves the stress. And one of the things for listeners who don't know, you are a retired Army captain.
Yeah.
Very proud. Thank you for your service.
Thank you. Hoorah.
Yeah, love my freedom, and I thank you for it.
Since you're talking about me, we'll bring up your son. Tell me about your son here.
Yes, thank you. My son, he serves at the 106 Rescue Wing right here in West Hampton.
Yes.
The fine men and women out there that do a great job for all of us here on Long Island.
Absolutely.
If you've ever been involved in a life-threatening water incident, it's nice to know that these guys are on our coast.
That's right.
There to rescue. But, one of the things that we deal with, we have several patients who suffer from PTSD. Mm-hmm. And this is a very important issue to me, because I know its effects firsthand. So looking at this, my father was an Air Force pilot. My uncle, 3 of my cousins, and now my son is in there. So I saw what my father went through in combat, and this issue hits close to home for me, and I want to protect my son from that if I can. He's young; he's just starting out, but I don't want him to feel those effects. So the red light bed is fantastic. I have a couple of your Army buddies mm-hmm. who've been deployed several times in the Middle East, and they struggle. And when they come back and they go in that red light bed and they just lay in there for 20 minutes, it's nice, relaxing, spa music is on, and they come out and they say, wow, I have this sense of clarity. Right. And I really feel good. And the red light, it is phenomenal. There's science that backs it up. Photobiomodulation, it's real science. It really works. But you go in there and you feel good.
Right. That's important. You want a nice, comfortable environment, and it's a clean environment. I've been there several times. The rooms are clean. The machines are clean. They're wiped down after every treatment. You're dealing with everyone who's certified. You keep mentioning yes. Fran. Who's Fran?
Okay, so for those of you, if you've listened to my show, if you've listened to Revital Wave Radio Tuesdays at 5:30 right here on this very station, you may have heard Fran. Fran is my partner in business, in life, in everything. We just celebrated our 34th wedding anniversary last weekend.
Congratulations!
Thank you. 34 years married, 37 years together, mm-hmm. and we work together. We live together. We spend all of our time together. And Fran, this was her idea. She's the one who was behind Revital Wave. She's a cancer survivor. She was always looking for alternative methods of healing and staying vital and staying young and looking and feeling good. So this was really her baby. This was her idea.
Yeah. Well, it's important. She was seeking, something to help her. Now she's able to give back to the community and offer something and make a difference.
Oh yeah, and ladies, let me tell you something. She's got her group of patients. She's got her 20, 30 ladies that come in there, and they're like a big group of friends. Really, they're like it's not only the treatment that they get with the camaraderie. They talk to each other, and they get it's
right.
It's a really nice little community.
Yeah, becoming like a little family. That's important. You don't want to go into a sterile environment and like you're walking on eggshells. Your doctor, or you're going to a business. You should feel comfortable. You should feel wanted.
Oh, absolutely.
Because we're offering a service. It's that holistic approach, the mind, body, spirit. You want to really embrace the individual and treat him with respect and offer procedures, and you're going to get good success that way. All right, we have 50 seconds left, so let's go over your radio show and then how your contact information. I'll wrap up.
Yeah, so when you listen to Revital Wave Radio, Tuesdays at 5:30, right here on LI News Radio, you'll get a lot of good answers to questions that you might not even know you had to ask. And you can reach us on revitalwave.com or 631-597-0000.
Fantastic. Make that call. If you need the services at Revital Wave, please give them a call. We're here for you. All right, so let me help you lead a happier and healthier life. If you wait, it may be too late. To learn more about my practice, go to drtomio.com. That's drtomio.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, which is the garden level, East Patchogue, New York, or give me a call at 631-980-8200. That's 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.